In today's class, we are going to learn about diseases and disorders due to lifestyle modifications. Life itself is difficult in the present world. Even a small child says, tension, life is stressful even for a small child. We are exposed to lots of stress and strains in our daily life. So, we are prone to many disturbances in the normal functioning of our body, leading to different diseases and disorders. But these diseases are not transmitted to the next generation. So you call these as non-communicable diseases. First we are going to see about diabetes mellitus. Diabetes mellitus, which is a Greek word. Diabetes meaning running through, and mellitus is sweet. So it is characterized by an increased blood glucose level, that is hyperglycemia, that is mainly due to insufficient secretion of insulin. This it is an endocrine disorder. And there are different types of diabetes. Type 1 and type 2 are increasing worldwide. First, type 1 diabetes, you call it as IDDM, insulin dependent diabetes mellitus. It is also called juvenile onset diabetes, that is mostly occurs in small children or below the age of 20 itself it starts. So it is called juvenile onset diabetes, and it's around only 10 to 20% of the population. That is diabetes population. And then this is mainly because of the destruction of the beta cells of pancreas, which secretes this insulin. So due to inadequate level of this insulin, this defect occurs, that is hyperglycemia occurs, that is diabetes mellitus. That is why it is insulin dependent diabetes mellitus, and it is a genetic factor. It is caused due to genes or sometimes even due to environmental factors like an infection due to virus or acute stress may also cause this type 1 diabetes. Then coming to type 2, non-insulin dependent diabetes mellitus, that is NIDDM, that is adult onset diabetes mellitus. It is it actually 80 to 90% of this diabetes is only type 2 diabetes, and this is because the insulin production is not adequate. The cells they produce insulin, adequate insulin, but the action is impaired. That is, the cells which target cells do not respond to the insulin. That is why it does not convert the glucose into glycogen easily. So more of glucose remains in the blood itself, leading to an increased blood glucose level, that is hyperglycemia. This causes, when you look into the causes for this type 2 diabetes, it is there are various factors that causes type 2 diabetes. That is mainly physical inactiveness. We don't do more of physical exercises, activity, and the sedentary life is main reason. It may also be due to the age, then obesity. Symptoms of this diabetes mellitus, that is hyperglycemia, mainly increased blood glucose level. Actually, the insulin converts the blood glucose into glycogen and it stores it in the liver or the skeletal muscles for further use. When this insulin is not in sufficient level, the glucose remains in the blood as such without the conversion. That increases the blood glucose level. That is called hyperglycemia. And then, so that is one of the major symptoms. And next is polyuria, frequent urination. Then polydipsia, this frequent urination, that is polyuria, leads to dehydration. When more urine is frequently passed, it leads to dehydration of our body. More water is lost from our body. Next is polydipsia, increased water intake. Thirst becomes more, so that more water is taken in, and more water is taken in. Then next is polyphagia, excess hunger is one of the symptoms for diabetes mellitus. Then next is glycosuria. Glycosuria is glucose is sent out in urine. When more glucose is there, that is when sugar level increases a lot, some of it is excreted along with the urine. That is called glycosuria. And becoming tired, then losing of weight is there are other symptoms for type 2 diabetes. Then next is prevention and control of diabetes. Mainly 3 aspects. When they are controlled, diabetes can be brought under control. They are diet, then drugs, and then exercise, physical exercise. Diet, what type of diet is to be taken is, dietary management is low carbohydrate diet, fiber rich diet, and more of proteins, whole grains, millets, green leafy vegetables, and then unpolished rice to be taken by the diabetic patients. And then the fat also, moderate amount of fat, and especially the saturated fat should be fatty acids should be avoided. Polyunsaturated fatty acids, what you call it as PUFA, should be taken in a higher level. So diet, when it is under control, we can control 1/3 of our that is diabetes. And then physical activity, regular physical exercise is must for this managing the diabetes, so that this physical exercise will convert the glucose into glycogen easily, so that you can reduce or control this diabetes. Then management with insulin, not directly insulin, drugs are there to control or manage this diabetes. When it increases, you can also use this commercially available insulin, so that it could be brought under control and the sugar level could be managed easily. Then at last, but that is the main thing, that is education and awareness. Once we are aware about the ill effects, the problems of this diabetes, we should awake at least to do physical exercise, be active, so that we can come out of it. So knowledge about this diabetes mellitus and the effects of diabetes mellitus in our body should make us be cautious and be out of this diabetes mellitus. Next is obesity. What we come across in the present generation mainly is obesity. When children of small age are fat and obese, it doesn't look odd. We feel chubby children, and we feel very happy looking into them. But when they grow, if it continues, it leads to various problems. So this abnormal, there is deposition of fat in the body, increases the body weight. That is called obesity. Abnormal or accumulation of excess fat in the body, that is obesity. And then it leads to, it influences the social, behavioral, psychological and metabolic and cellular factors of our body. It causes various problems in later stages. That is, what is obesity is the calories what we take, when it becomes more than the calorie what we spend, that leads to obesity. Energy spend பண்றது, calories spend பண்றதை விட ஜாஸ்தி நம்ம சாப்பிட்டோம்னாக்க, calories எடுத்துட்டோம்னாக்க, that leads to obesity. And the body weight actually becomes greater than the mean standard weight. We call BMI nowadays. Everybody are aware of this, body mass index. And when it becomes greater than that of our age and height, that makes it know that we are obese. So then what are the causes and the risk factors of obesity? Causes that might be genetic, or physical inactivity, lack of proper physical exercises, then eating habits and taking more of fatty food, and then even it may be hormonal. It may be, their endocrine factors also may be the reason for this obesity. It's a positive risk factor for many problems like hypertension, diabetes, then heart problems, that is coronary heart disease, arthritis, and so on. Many diseases are maybe due to this obesity. Obesity is the reason for one of the reasons for many diseases. Then prevention and control of obesity. Only two aspects. One thing is diet management, the other is physical exercise. Diet, we should take in low calorie, high fiber, normal proteins, vitamins, etc. Contain food, and then calorie restriction to reduce the weight is main, and that is most effective. Low calorie food should be taken, and then conscious should be there for mainly the physical exercise. Low calorie diet. Simultaneously, we should do physical exercises that will reduce or control the obesity. Meditation, yoga, physical activity will reduce the stress of being obese and will control obesity. Next is heart disease. Cardiovascular disease, CVD, is associated with disease of the heart and the blood vessels. Vascular, so blood vessels. Then coronary heart disease, CHD you call it, and that is the common form of heart disease that is due to the deposition of cholesterol in the blood vessels. That is a common problem we face, deposition of cholesterol in the blood vessels. That is even from a middle age, even in lower ages this starts. It is a slow process, doesn't occur all of a sudden. Gradually fat or cholesterol gets deposited in the inner walls of the blood vessels that forms plaques. அப்படியே சின்ன flakes மாதிரி சின்ன pieces அப்படியே கொஞ்சம் கொஞ்சமாக டெபாசிட் ஆகிட்டு வருது. அதை தான் என்னன்னு சொல்கிறோம், பிளேக் ஃபார்மேஷன் சொல்கிறோம். பிளட் வெசல்ஸோட உள்ள ஒரு லைனிங் ஃபார்ம் ஆகிடுது. உள்ள லைனிங் ஃபார்ம் ஆச்சுன்னா என்ன, பிளட் வெசல்ஸோட டயமீட்டர் குறைஞ்சிடுறது இல்லையா. ஸோ தெர் இஸ் நோ ப்ராப்பர் ஃப்ளோ ஆஃப் பிளட், சஃபிஷியன்ட் பிளட் ஃப்ளோ இஸ் நாட் தேர். ஸோ தட் லீட்ஸ் கன்ஸ்ட்ரக்ஷன் ஆஃப் த பிளட் வெசல்ஸ், தட் லீட்ஸ் டு தி constriction of the blood vessels, that is called atherosclerosis. Atherosclerosis, and this occurs mainly in the large blood vessels or the medium sized blood vessels that supply the muscles of the heart. So heart க்கு தேவையான blood flow குறைஞ்சிடுது. அந்த muscles, heart muscles க்கு போற blood vessels இந்த மாதிரி சின்ன சின்னதா பிளாக் ஆகிறதுனால அங்கங்க ஹார்ட்டுக்கு மசில்ஸ்க்கு தேவையான blood flow வந்து குறைஞ்சிடுறது. That leads to ischemia, a disease called ischemia. அப்படின்னா ஹார்ட்டுக்கு தேவையான blood flow கொஞ்சமா இருக்குது, போறல ஹார்ட்டுக்கு வேணுங்கிற blood இல்லாதனால ஆக்சிஜன் பத்தல, that is called ischemia. So and that leads to myocardial infarction. Myocardial infarction is nothing but like heart attack. அப்படியே அந்த blood flow இல்லாதனால அப்படியே heart attack வந்துடுது. So that may even be fatal. Risk factors, that is எதனால மெயினா வருதுன்னா ஹைப்பர் கொலஸ்ட்ரீமியா. ஜாஸ்தி கொலஸ்ட்ரால், when the blood cholesterol is more, that is one of the main factor that causes this CHD, coronary heart disease. Then next is not only the heart is affected, when cholesterol content in the blood is more, it also affects the brain, kidney, and it may even lead to stroke. It may even supply less oxygen to the brain, and it may even cause stroke. Then causes for this CHD, coronary heart disease, mainly it may be genetic, family history, hereditary, and then diet rich in cholesterol. When we take a lot of saturated fats, it causes that is we are prone to such diseases. And then increase in age, then smoking, alcoholism, then emotion, stress and strain in our life, then sedentary lifestyle without physical activity, less of physical activity are some of the reasons for this heart disease. And then symptoms, shortness of breath, pain, chest pain, then suffocation, shortness of breath, headache, and then dizziness, then tiredness, swelling in the leg or pain in our back even, and then gastrointestinal disturbances. These are also the symptoms for this coronary heart disease. Then prevention and control of this heart disease, mainly diet management, less cholesterol food we have to take, and you have different types of cholesterol, that is high density cholesterol, low density, very low density cholesterol, and so on. This high density lipids, HDL we call it, high density cholesterol is good cholesterol, and that actually lowers the risk of heart attack. But this LDL, low density cholesterol lipid, is called bad cholesterol. That is actually very risky factor for this disease. And then we should avoid a saturated fatty food. We should go in for this polyunsaturated fatty food, and avoid fatty food first, and then more of fiber food, and then rich, we have to take in more of vegetables, green leafy vegetables, fruits, and so on, which are rich in proteins, minerals, vitamins, and so on. Then physical activities, regular exercise, walking is essential for maintaining our health normal. And then addictive substances should be avoided. Smoking, alcohol, consuming alcohols, all should be avoided. Only then we can be healthy. We can lead a healthy life. We can prevent this heart problems.